Hi all, welcome to Physio Exam Buddy. This video is on the nerve action potential. First, about the definition of the nerve action potential. Changes in the membrane potential that spread along a nerve fiber membrane when a stimulus of threshold intensity is applied. It is known as the nerve action potential and it is recorded using an instrument which is known as cathode ray oscilloscope. This is the diagram you have to draw while answering the question for nerve action potential. You can see here that in the x-axis the time is shown and in the y-axis the voltage which is shown in millivolt is there in the y-axis and the value ranges from minus 70 millivolt to plus 35 millivolt. So you can see here that this is the nerve action potential when a stimulus of threshold intensity is applied, the nerve action potential will be generated. That is, the membrane potential will rise from a resting membrane value of minus 70 millivolt in a neuron to plus 35 millivolt. Then again, it will come back towards the resting value. Now we will see the stages of the nerve action potential. First, about the resting stage. Resting stage, it is the resting membrane potential or RMP of a neuron and it is the voltage at which the membrane is said to be polarized or charged. And in case of neuron, the resting membrane potential, it is minus 70 millivolt. So, you have to draw it as a horizontal line, that is the resting membrane potential or the RMP. And when a stimulus is applied, that is when a stimulus of threshold intensity is applied, you can get a brief irregular deflection at this baseline. And it is basically due to the current leakage from the stimulating electrode to the recording electrode. Followed by this stimulus artifact, you will get a latent period, again a isopotential line. That is, this isopotential interval which follows the stimulus artifact and ends with the start of the action potential, it is known as the latent period. And it is basically the time taken by the impulse to travel along the axon from the stimulating electrode to the recording electrode. And this duration, it is directly proportional to the distance between stimulating as well as the recording electrode and inversely related to the speed of conduction. The stage following the latent period, that is where the charge changes from minus to positive, this stage, it is known as the depolarization stage. But you can see here that the speed of depolarization is not uniformly changing throughout this depolarization stage. So after this latent period, you can see here the initial depolarization, that is up to 15 millivolt depolarization, that is the difference between minus 55 and minus 70, that is 15 millivolt of depolarization. The rate of depolarization is basically slow. But after this 15 millivolt, you can see here that the rate of depolarization sharply increases and the point at which this change occurs, it is known as the firing level or the threshold, and it will reach the potential change reach from negative to zero very rapidly. And in case of large nerve fibers only, this membrane potential overshoots beyond zero and becomes a positive of plus 35 millivolt, and this happens only in case of large nerve fibers, whereas in case of small nerve fibers and in many CNS neurons, the potential merely reaches this zero level and it does not overshoot above this zero level in case of small fibers and in many CNS neurons. Following this depolarization phase, you can see here that again the potential change from plus to minus charge, that is normal negative resting membrane potential is re-established, and this phase, it is known as the repolarization, that is from positive to negative. This change, it is known as the repolarization phase. And after reaching the peak, you can see here that the curve reverses back and fall rapidly towards the resting level, which is minus 70 millivolt. And this rapid rise of potential after the firing level during the depolarization together with the rapid fall during the repolarization, this phase it is known as a spike potential. And after this repolarization phase, you can get another phase which is known as after depolarization. That is, when the repolarization phase, it is almost about 70% complete. You can see here that the rate of depolarization decreases, and this slower repolarization phase that occurs at the end of this spike potential, it is known as the after depolarization phase. So this rapid depolarization till this, that is the rapid repolarization, this phase together forms the spike potential, and after spike potential, this slow repolarization phase that occurs after at the end of the spike potential, it is known as the after depolarization phase. And after depolarization phase is followed by after hyperpolarization phase. That is, once this rusting level is reached, that is minus 70 millivolt, the potential further falls and becomes more negative. And this phase below minus 70, it is known as the after hyperpolarization phase. So this is the diagram in short. That is, first there will be a stimulus artifact followed by latent period, then the beginning of the depolarization, and the first portion of the depolarization, that is up to 15 millivolt, that is up to minus 55 millivolt. It is the rate of depolarization is very slow, and when it reaches the firing level of minus 55 millivolt, the rate of depolarization occurs very rapidly. And in case of last knife fibers, this depolarization, the potential will overshoot beyond zero and even reach up to plus 35 millivolt, and this portion it is known as the overshoot, followed by the potential reverses, and this phase which is known as the repolarization, which will be followed by the after depolarization, that is the rapid depolarization plus the rapid repolarization, they together forms the spike potential, and at the end of the spike potential, the rate of repolarization is found to be decreased, which is known as the after depolarization. And when the potential reaches the minus 70 millivolt, you can see here that the potential again goes below minus 70, and the potential when it goes below minus 70, that phase it is known as the after hyperpolarization phase. Now about the ionic basis of the nerve action potential. In case of neurons, the cell membranes of the nerves mainly contains two types of channel. That is, voltage gated sodium channel is there, as well as voltage gated potassium channel is there, in addition to the sodium potassium pump as well as the potassium leak channels. And the changes in the membrane conductance of the sodium and potassium through these voltage gated sodium channels as well as potassium channels, they are responsible for the generation of this nerve action potential. And out of this voltage gated sodium channel, it is necessary for causing both the depolarization as well as the repolarization phase, whereas the voltage gated potassium channel, it basically increases the rapidity of the repolarization. Now we will see the ionic basis of depolarization. That is, when a threshold stimulus is applied on the neuron, some of the voltage gated sodium channels in the neuron will open. When the sodium channel is open, you know that the most abundant ion in the extracellular fluid is the sodium chloride. So the sodium influx occurs, that is from the outside to inside of the membrane. So once the sodium influx occurs, you know that the charge of the sodium is positive. So the inside of the membrane becomes more and more positive, and the word meaning of depolarize, you know, it is the charge will shift from minus to positive. That is, because of the influx of the sodium ions, more and more positive charge is entering into the neuron, and the membrane potential shift from minus to the plus because of the influx of this positive charge ion, that is the sodium ion. That is, the membrane will begin to depolarize, and the inward movement of the sodium will set up a positive feedback mechanism, causing opening of the more and more sodium channel. And this positive mechanism or the positive feedback mechanism, it is also known as Hodgkin cycle. And Between this -70 and -55 millivolt, the opening of this numerous voltage gated sodium channel occurs, and there will be massive influx of sodium, that is rapid influx of positive ions into the neuron, which is responsible for the rapid shift of the charge from minus to the positive charge. And the massive influx of the sodium into this cell carries the membrane potential more towards the equilibrium potential of sodium, that is plus 60 millivolt. But you can see here that the potential, that is the depolarization values, only reaches up to plus 35 instead of this plus 60 millivolt. And the reason is that the sodium channels is only short-lived, and the direction of the electrical current for the sodium, it is reversed during the overshoot because of the membrane potential is reversed, which will further limit the influx of the sodium ions. The depolarization phase, it will be followed by a repolarization phase, and the main change occurring here is that there occurs an increase in the potassium efflux, and there will be a decrease in the sodium influx, which causes the repolarization. And the main reason for the repolarization is the opening of the voltage gated potassium channels. A bit in detail about the voltage gated sodium channels. You can see here that this is the diagram of the sodium channel. This is the cell membrane, that is the fluid mosaic model of the cell membrane, which include the phospholipid bilayer. And in between you can see the voltage gated sodium channel. And you can see here that this is the extracellular fluid and this is the intracellular fluid. This is the extracellular portion of the nerve membrane, and this is the intracellular portion. You can also see two gates which is present in this voltage gated sodium channel. The outer gate, it is known as the activation gate, whereas the inner gate, it is known as the inactivation gate. And during the rusting phase of a neuron, this activation gate is normally closed, and the sodium from the ECF cannot enter into the inside of the membrane through this gate. But when the membrane potential becomes less negative than the rusting stage, it causes a conformational change in this outer gate, and it causes the opening of this activation gate, which result in the influx of sodium from outside to inside of the membrane. And the same increase in the voltage that opens the activation gate will also closes this inactivation gate, but after a fraction of second after the opening of this activation gate. And this conformational change that closes the inactivation gate is a slower process. So sodium cannot enter the inside of the membrane after this portion. Next is about the voltage gated potassium channel. Again, this is the lipid bilayer of the cell membrane, and this is the potassium channel. But you can see here that in case of voltage gated potassium channel, there is no outer gate. There is only one gate which is present on the inside. And during the rusting stage of the membrane, this potassium gate is always in a closed state. And when the membrane potential rises from -70 to 0, there occurs a conformational change which causes the opening of the gate which is present inside the cell membrane, and potassium from inside the cell will diffuses out. And this potassium channel open at the same time when the sodium channel are beginning to close because of the inactivation. So basically, the decrease in the sodium influx as well as increase in the potassium efflux, it increases the speed of repolarization. That is the change of the charge back from plus 35 to minus 70 millivolt. So followed by the repolarization, there will be after depolarization phase, which is because of the slower exit of the potassium ions. And after depolarization, there will be the after hyperpolarization phase, where the membrane potential goes below the resting membrane potential. And the reason for this phase is continued efflux of potassium ions. So the ionic bases, in short, the slow rising phase, that is from -70 to -55, it is because of the entry of sodium ions through some voltage gated sodium channel, which will cause the positive feedback mechanism of the Hodgkin cycle, resulting in the opening of numerous voltage gated sodium channel and sodium influx, resulting in the rapid rise in the depolarization phase. And this will be followed by a rapid falling phase because of the decrease in the sodium influx as well as potassium efflux, which is responsible for the repolarization or the rapid repolarization phase. And the after depolarization phase is because of the slower exit of potassium, and after hyperpolarization because of the continued efflux of the potassium, that is the positive ions, it will be going out. So the membrane inside the neuron becomes more and more negative. That is why the membrane potential goes below -70, that is below the resting membrane value. And there are certain other ions also responsible for this nerve action potential. So your answer will be complete only if you write the role of other ions during action potential. And the major ions are basically negative ions and the calcium. There are many impermeable ions in our neuron, that is anions of protein molecules as well as the organic phosphate and sulfate, etc. They are responsible for the negative charge inside whenever there is a deficit in the positive ions. That is the role of the impermeant ions. Next, about the calcium channel. In addition to the sodium and potassium, there are certain voltage gated calcium channels are also there in the nerve action potential, which will be contributing to the depolarization phase of the action potential in the cardiac as well as smooth muscles. And this calcium ion concentration is more in the extracellular fluid. So in response to a stimulus that depolarizes the cell membrane, the calcium ions will flow into the interior of the cell, and they are basically so slow channels which provide sustained depolarization. And in case of situations whenever your body calcium level or the serum calcium level decreases, the sodium channels will become activated by a very small increase of the membrane potential, and the nerve fiber becomes highly excitable. That is, whenever a calcium concentration in the human body goes below 50% below the normal, there occurs spontaneous discharge occurs in the peripheral nerves, and this condition it is known as the tetany because of the decrease in the serum calcium level. And the muscle tetany is basically lethal, that is, it can cause death of that patient because of the tetanic contraction of the respiratory muscle. So please keep in mind this portion. It can be asked as a physiological basis question, that is, why there is neuromuscular hyperexcitability in tetany. And the reason is that in tetany, the calcium level is low. That is, whenever the calcium level decreases, there is a tendency of the sodium channel to become activated by a small increase in the membrane potential. That is, it lowers the threshold of the opening of the sodium channel. So the nerve fiber becomes highly excitable, and that is the reason by which the neuromuscular hypoexcitability occurs in case of tetany. And the reason is that the calcium usually bind to the exterior surface of our voltage gated sodium channel, and it will alter the voltage level required to open the sodium gate. Whenever the calcium level goes below, there occurs a decrease in the threshold for the depolarization, which will cause an increase in the excitability of the nerves, and the nerves can even discharge without provocation. That is the reason for the neuromuscular hyperexcitability in tetany. Thank you.